As COVID cases spiral upward and new warnings resound, people in many parts of the world find themselves wondering if the summer respite we'd hoped for could come to an abrupt end. All thanks to a new and especially adaptable strain. First identified in India, it's known as the Delta variant and is significantly more contagious than previously thought. After completely overwhelming India's healthcare system and causing mass suffering and death, the variant has spread to more than 80 countries. Vaccines should stop it from spreading, but it's a race against time. And with many countries already returning to normalcy, reimposing rules could be difficult. Corona mutations, how deadly is Delta? Welcome to the Point. It's a pleasure to welcome our guests. Tobias Kurt is an epidemiologist from the Charité in Berlin, and he says the best way to counter the Delta variant is to intensify the vaccination campaign and engage in more targeted surveillance rather than panic-mongering. And it's a pleasure to welcome Benjamin Alvarez-Gruber. He is a DW colleague from Chile, and he believes the worrying developments in Chile should be a warning sign for those who pledge to reopen fast as vaccination campaigns gather steam. And we're very glad to have back on the program Ankita Mukhopadhyay. She is a DW correspondent based in Delhi, and she is convinced we need to rely on scientific expertise along with rigorous safety measures if we want to prevent this rise of more dangerous variants. So let me begin by asking you, Dr. Kurt, we've got sunny days here in Berlin. We've got balmy evenings, plummeting infection rates. Things have been looking pretty good, and now I find myself thinking, are we going back to where we were at the end of last year? Are we really seeing a dramatic risk of another spike? I know you say we shouldn't be doing panic mongering, but how dangerous is it?
Well, first of all, we should enjoy right now the situation. And as you said, the numbers are going down. So the infection rate is really on a really, I wouldn't say record low, but it's really reassuring. Yes, the pandemic situation is not over. There is a risk that we see a potential increase in the fall again. However, we have to look in more detail. So PCR test positive doesn't mean there's a consequence, doesn't mean that if I have a positive test result, I can spread or give the virus to someone else. We need other information to really tell that. Also, you may get mild symptoms if you're vaccinated, but may not get severe disease. So we have to look a little bit more careful rather than saying just PCR test positive, which will go up very likely in the fall. So it depends on the setting, on the region, on the country, the number of people vaccinated, whether this is a true risk or not. We should be respectful. We should be on alert to really watch the situation closely, but to really now think what may have happened or what will happen in the fall. I think it's a little bit too early to be alarmed in a way that we're having panic.
Let me go to Ankita, because you, Ankita, said in your statement that we need to rely on scientific expertise. And in fact, India is working to sequence thousands of samples at the moment. So what do we know so far about why the Delta variant is so dangerous and whether it or new mutations like Delta Plus could elude existing vaccines?
What India has done is, for this time, as compared to what happened in the last wave in April and May, they have classified the Delta Plus variant as a variant of concern. So that means there is health surveillance going on and the tracking of, these cases. But what India still lacks is a lot of research into why the Delta variant is leading to so much hospitalization. And that the research is not happening because the focus has right now completely shifted from listening to experts to focusing more on, administrative stuff like, procuring oxygen, imposing lockdowns, because India cannot afford to have like another wave. So that's been the issue at their end. But what we need to understand is that the Delta variant will expand its will reach more people, more vulnerable populations, because India's vaccination rate is like really low.
Thank you very much. And we're going to come back to that in just a moment. But one place where the vaccination rate has been very high is your country, Benjamin, Chile. In fact, more than 78% of the population has now been vaccinated once, 62% twice. And yet a new wave of infection is washing over Chile. Why? What are the scientists there saying?
The scientists are saying that they warned the politicians who took these decisions. On one side, we have Chile with an incredible vaccine campaign. You just mentioned the numbers. When we have Chile, we have, for example, Israel, countries who have had a very successful and very quick vaccine rollout. But on the other side, you see politicians taking decisions like lifting mobility, giving people the chance to go from one place to another, even if they had both vaccines, having these dynamic quarantines that mean that if you're living in the city, in one place you can move freely, and in the other ones you have to be isolated at home. And of course, if there's a lot of mobility, even if you have a lot of people, a lot of the high percentage of the population that have been vaccinated, they will not be efficient. And then you will have high numbers like the ones that we're seeing now. And Chile is entering winter now, so the numbers are expected to continue increasing, strengthening, and getting the hospitals also in a really difficult situation that they don't have capacities in many of these intensive care units anymore.
Thank you very much. Let me ask you, Tobias Kurt, what lessons can we learn from Chile? I think many of us, and in fact, in your opening statement, you also talk about the need to intensify the vaccination campaign. And I think many of us thought that if we did that, and it has intensified here in Germany now, for example, that the likelihood of dangerous new mutations would fall. Yet apparently that's not the case in Chile.
I don't think that the likelihood that a variant develops is falling, but the likelihood that people get sick or spread the virus. So that's something different. So the development of variants will continue on a global level for sure. As many people get infected and as more people get infected, there will be a variant in that specific setting which then is superior to other variants. Which does not mean that if you take that virus and put it in another setting, that it will act in the same way. So we have to really carefully look at the data, collect the right data, carefully see how the dynamic changes in terms of number of people vaccinated, number of people getting sick, number of people testing positive, and what it means for the respective setting. So it's important to not just look at one number. We have to look at the totality of the dynamic situation before we make decisions. But we have to be careful and on alert to really not say, OK, things are over, and communicate that. No, things are not over. Things can come back, but the question is how.
So from what I'm hearing, we have to remain vigilant even if we get close to that holy grail of herd immunity.
Yes, but herd immunity is not a specific number. It's dynamic. Depending on the likelihood that a virus spreads, this will affect the cutoff of a so-called herd immunity. So we have to be on alert, but without being panicking, specifically in Germany. On the global level, again, many countries never had the chance to get one person vaccinated because they don't have any vaccines available so far. We come back to that later, I believe. So it's really important to understand the situation and to have a surveillance system that actually works, and we're looking at the right numbers.
One other very quick follow-up question. Many people in Chile were vaccinated with the Chinese vaccine, with Sinopharm. Does the fact that infection rates are rising reflect defects in that vaccine?
No, I think even if you're vaccinated with any vaccine, you can test positive. The question is, what does it mean? Are you really getting sick? And I'm not familiar with the numbers in Chile. So it's not just looking at testing positive, because that likelihood exists even after BioNTech or Moderna or AstraZeneca. So I don't think it's a question of quality of the vaccine that has been given out in Chile.
Benjamin, do you want to weigh in on that point?
No, I agree totally. And I think what's important is not just the vaccination, but the crisis communication. To say not go into panic and the Delta variant is coming. I mean, authorities in Chile say it hasn't reached the country yet, but let's see, it's only a matter of time, right? But it's to say the pandemic is not over, the numbers are rising, and we cannot just rely on the vaccines to say if we vaccinate amount of people in the country that the cases will go down, because that's not the case.
And let's talk talk a little bit more about precautions and also take another look at travel, because, of course, we are now moving into summer, and many people have been hoping to have a semblance, at least, of vacation. So, Ankita, in India, the religious festival Kumbh Mela is often blamed for having been a super spreader in the late winter, early spring. To what extent was travel implicated in that terrible surge that we did see in India? And have people changed their attitudes in regard to travel?
I would say in terms of traveling interstate, there has been a reduction. People are actually more than aware, they're very scared, especially with the rising number of deaths. But what we need to understand is that when public transport, it's already started opening up in big cities like Bengaluru, which saw like a huge surge, last month. So we see public transport opening up, and there is an uptake in public transport. And in a country with over 1 billion people, it's very difficult to socially distance. So it's very necessary for the government to keep iterating that, you have to maintain social distancing, you have to wear a mask, you have to get vaccinated. And I think the issue that's happening right now is that people are becoming very confident that they've got the first jab, so they're probably safe, but that's not true. So we have to be very careful in terms of like interstate transport.
Thank you very much. And in fact, Benjamin, I've seen reports that in Chile, apparently during the holidays between December and February, there was quite a bit of travel by people between their first and their second vaccine, when apparently they did not have full resistance yet. So travel implicated there as well, I gather.
Yeah, there was even a holiday permit where you could go to the beach and visit families as well. So it's also, that's a contradiction. On one side saying you have to take care, but on the other side it's possible to get this permit. And people who have now the 2 vaccines are able even to move. So it's a mobility pass. And the scientific world says, what we don't need now is to increase mobility. So that's, of course, is also something that should be discussed about, not just traveling in the country, but also trying to get out of the country.
In fact, when it comes to mobility, the British government has also been been criticized for not banning travel from India as early as needed. And we need only look at the UK now to see how infectious Delta is. The new variant is now almost exclusively responsible for a surging infection rate. That prompted authorities to postpone the long-promised lifting of lockdown restrictions, and it's causing worry elsewhere as well.
Great Britain responded to the Delta COVID variant with a massive vaccination campaign. Even though the country has the highest vaccination rate in Europe, the Delta variant is spreading throughout the country like wildfire. The outbreak started in Scotland before spreading all over Britain. London was a hotspot. The lockdown reopening in England has been delayed. Portugal has turned to more drastic measures. Residents of the capital, Lisbon, are prohibited from leaving the city on weekends. The police even patrol the exit ramps. In April, the country had the lowest infection rate in Europe. The Delta variant may have come in via Britain. British tourists in Portugal weren't required to quarantine like in other European countries. And these images are from Europe. Full beer gardens and packed bars, as well as full stadiums for the Euro 2020 championship. Is Europe heading into the next wave without a plan?
Dr. Kurt, what's your answer to that last question? Is the situation in the UK, in Portugal, a wake-up call for all of Europe? Should we be doing things differently?
If people believe the pandemic is over, yes, there should be a wake-up call that things can change quickly. It is and remains a dynamic situation. We have to be careful in traveling. The virus itself doesn't travel. It needs a host, humans or animals, in this case humans. So if humans travel, we can test, we can quarantine, we know all this. And we have to implement this and really be extremely careful to not running into the next wave.
Nonetheless, in your opening statement, you didn't advocate a new blanket lockdown. You said we need targeted surveillance. In fact, at the height of the second and third wave, it became very difficult for authorities to track infection chains. There were simply too many cases. Has that changed now that infection rates here, at least in Germany, are falling?
Right now, that should be possible again, and we should try everything to maintain that level, that we can trace and track and really know what's happening. But also we need information about how likely it is that a person can spread the virus. So there's another value, the CT value, for example, that we need to take into account. Did that person travel? What profession has that person? So that we really understand the situation rather than saying everyone lockdown, because I think that's not a good solution. We have learned better over the last month, hopefully.
Thank you very much. And let me ask Benjamin, because you, of course, are based here in Germany. And I know that this new lockdown in Lisbon and the postponement of lifting of measures in Britain, they do have a lot of people here worried. On the other hand, people are just getting used to this new normal. Things seem so good and relaxed. Do you think that it's going to be very hard for people here to accept if new restrictions do in fact have to be put into place?
I think it will be difficult if I compare the situation in Germany with the situation in Chile, where it's this back and forth. So we have to quarantine, then the situation is getting better, then you can move, then again you have to stay at home. So that's why it's so important to have this crisis communication and go in one way and say, you know, situation will get worse, probably in the next month. The cases will go up, so it's important to take care now. And there are several tools that we have. Well, vaccines is only one tool, but you have to have tracing of people. Where they're traveling now during the Euro Cup. Germany will face England in Wembley, of course, and then you have Budapest seeing pictures of a full stadium, 100% capacity. And then, of course, it's important to see which travel is essential and which travel could also lead to more cases when people start moving around and restrictions are lifted also when it comes to traveling and quarantining in the country where you're going to.
Dr. Kurt, when you see those pictures of full football stadiums, when you hear that London is still planning to host the European Championship final in Wembley Stadium with 60,000 fans, do you think we've all got our heads in the sand?
Well, I hope they're a test before and after the game, everyone who is around that stadium or in that stadium. So obviously that's a quite risky situation that people are putting themselves in. And I hope that everyone understands that they have been exposed potentially and they should be tested or place themselves in quarantine after, and specifically if they have any symptoms suggestive of a flu-like symptoms or like corona symptoms, as many of us should know now.
Let me ask Ankita, because in fact, infection rates in India now are falling, although, as you pointed out at the beginning of the show, India has vaccinated only a tiny proportion of its population so far. So what is accounts for that fall in infection rates? And are you seeing signs in India of restriction fatigue?
So I'll answer the first question. So obviously, like every pandemic and every wave, there's like a peak and then there's a fall. So that's what happened in India. There is a fall now. But we are seeing cases steadily increasing of the Delta plus variant. Kerala and Maharashtra are great examples of what will go wrong in the future if, the governments, don't buck up. I think in terms of vaccination, what's happening is that we had a supply crunch at the beginning, in March, April, May. And that was sort of resolved with with Narendra Modi, the Prime Minister, announcing that we will re-centralize the distribution of vaccines. Now, the problem is that in a lot of the people, even if they're getting the first jab, they're unable to get the second one because there's just no supply. So now things have eased up with Sputnik, with I think the Novavax vaccine that's supposed to come. There's Covaxin, India's indigenous vaccine that's also there. But what I feel is the biggest issue right now is the kind of narratives that go around the vaccine. And there is obviously this big fatigue where people feel that, we have been locked up for too long and, we need to stop talking about the coronavirus and we need to start looking at the brighter side of life, which is a great way to think, but it's not something that you can implement on the ground if you suddenly just go out and, live your life normally again. And now the problem is that a lot of the offices are opening up. So people are, going back to work. So now with people going back to work, there's also narratives going around that India is a poor country, we're economically backward, we cannot afford to sit at home, we have to earn something. So these kind of narratives are sort of supporting the fatigue of the lockdowns.
Thank you very much. And I'll just say to our viewers that we're sorry that that image of Ankita occasionally is frozen, but I think we can all still hear her well. So that is great. Let us come now to a deeper look at the vaccination challenge. And in the race against time between variants like Delta and vaccines, poorer countries suffer a dramatic disadvantage. Despite the mantra that no one is safe until everyone is safe, the reality is that COVID-19 dramatically magnifies global inequality on health.
New Delhi streets are alive again. New infections and deaths are decreasing, but less than 20% of Indian residents have received one vaccination. Nevertheless, many of them are still convinced that they've learned from the pandemic.
I don't think people have short memory, but the things got recovered, and yeah, it was a very crucial time for everyone. But the thing that people and government, they did a lot, and I think it's fine.
In Brazil, on the other hand, the situation is worsening. The country now has more than 500,000 confirmed corona deaths. Brazilian President Bolsonaro downplayed the dangers of the pandemic for too long. Infections are rising in Chile as well, even though the government has tried to stop the virus from spreading with lockdowns and vaccination campaigns. Even worse, a new variant has been discovered in Latin American countries. Its dangers have not yet been analyzed. Do we have to learn to live with the virus and its variants?
Benjamin, Chile is now talking about giving a third booster shot starting early this fall. So two questions to you. First of all, the adequacy of the amounts of vaccine you do have in Chile. And secondly, do you think that the battle against COVID could wind up being decided not here in Europe or the US, but in the global south?
Totally. I mean, if we look at the vaccine rates of Africa, for example, Latin America, what Chile really is an exception if you compare it to other countries. We have the COVAX program, we have G7 countries pledging to donate more vaccines, but that's definitely not enough. And when you look at the situation, we just saw it in Brazil, what's happening in Bolivia, what happened in Ecuador, so in all of Latin American countries, there is definitely something that there needs far more support. And it's not just the vaccines, but also the financial support for the people, for them to stay at home, because that's important to note as well. Not everyone breaches the rules because they want to. There are some of them, of course, who go out, who have illegal parties, but others who have to go out where quarantine is not an option. I mean, that's a privilege during this pandemic.
Thank you. Dr. Kurt, grand promises were made during the G7 meeting about how much vaccine the North wants to send to the global South. But when you look at the actual numbers, I think it's 55 million doses that the U.S. has now pledged additionally. It's a tiny drop in the bucket. This is essentially a situation of triage, something doctors are very familiar with, where we have scarce resources and we have to decide where they are best used, given the magnitude of the problem. What would you say when you look at this health inequality and the very low numbers of people being vaccinated in poorer countries? Is that where we need to be sending vaccine right now, rather than keeping it here for ourselves in the rich North?
It's very unfortunate that the G7 and others speak about the importance of global health, but then in one of the biggest crises on global health, that the action is very, very limited. And so, yes, we have to understand it's a global pandemic. And if we do not prevent the globe pretty much from spreading the virus, then the virus will come back. So like the decision to my country first of those who can afford it and then sending a little bit of vaccine to other countries is not sufficient. We have to substantially increase the efforts and send vaccine to these countries and ideally build up production capacities in these regions so they can actually produce their own vaccines.
Let me go back to Ankita, because, of course, that was a big topic for us last time we talked on this program. The idea had been put out there that we need to see a lifting of patent restrictions so that countries in the global south can make more of their own vaccine. But in fact, India has the production capacity. It has the skills and know-how. The problem there was bottlenecks on resources. So are you any more amenable to those arguments about lifting patent restrictions than you were back last time we spoke?
Yes, they should be. The restrictions should be removed, because right now what we need to understand is we don't have much research on whether the indigenous Indian vaccine, which is Covaxin, whether it can prevent deaths or hospitalizations if you get the Delta variant. We only have research on Pfizer and AstraZeneca being the vaccines which are which can prevent death if you have 2 doses of the vaccine. So it is essential that we remove the patent restrictions on the vaccines that work, and we can produce them in India. Because the issue is that if you try to bring something like Pfizer in a country like India, which doesn't have that much cold storage, how are you going to store it? So if you remove the restriction, India can produce it according to its own convenience and in its own way. And I think that should be the case for most countries, especially continents like Africa, where the populations can't even get vaccinated before the 2023 or 2024.
Thank you. Let me pose one question with a request for a one-word answer to Dr. Kut and to Benjamin. Given where we are today, must we acknowledge Corona isn't going away and that it is time to simply focus our efforts on living with it and perhaps trying to mitigate its deadliness? Dr. Kut?
We're already living with so many viruses, and we will live in the future with Corona.
Benjamin?
There's so many tools, now we have to use them.
Thank you very much. And thanks to all of you for joining us for To The Point. Hope to see you soon.